Did you take your ibuprofen at school before you left?
No.
No?
Oh, yeah.
You did. You should have at 1 o'clock.
When Owen was very young, he would get strep throat a lot, 12 times in 14 months. And every time he got strep, he didn't run a fever. He never complained of a sore throat, but his behaviors would get strange.
Sometimes it makes me normal, and then sometimes I'm really just not me.
My name is Maria Wilson, and my husband Phil and I have a son. He's 9.5, Owen, and Owen was diagnosed with PANDAS last September. He had tics that were reoccurring, 30 or 40 times a minute. He couldn't focus. He lost most of his executive functioning abilities. He was struggling.
I'm an integrative physician specializing in PANDAS. The letters stand for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcus. And it is a disorder where strep infection triggers inflammation in the brain, causing neurologic and psychiatric symptoms. PANS is a condition, pediatric acute onset neuropsychiatric syndrome. And it's very similar to PANDAS, but in that case, other kinds of infections, such as influenza or Lyme, can be the trigger for it.
This whole disease is so confusing because it looks like so many other things.
People just don't think of it as like this crazy thing because it's like you don't have something like wrong in your body. Like you don't have like cancer, or you don't have like, something that doctors can like look at an x-ray and just see that's wrong.
But with the abruptness of it all, we just knew that there had to be something else going on. It wasn't just an anxious child. It was so much more than that.
I just became really quiet, and then when we would go to the doctor, they're like, oh, we think that you like had a reaction to like allergy medicine. Like completely changed overnight, and it's allergy medicine? Like, I don't know, it's like, it just did not make sense at all.
It's estimated that between 1 in 50 to 1 in 200 kids actually have infection-based autoimmune encephalitis, which is the umbrella term. PANDAS just fits under that umbrella. That's at least 10,000 kids in Michigan.
There's one treating neurologist in this state who's willing to do IVIG, and that wait list it was 1.5 years long when I got onto it, and now it's 2.5 years long.
It should be something that all pediatricians, that should be a required course for anybody going through school to be a pediatrician, and even something for continuing ed for pediatricians just to understand this, because it is 1 in 200 kids. That's a lot of kids. I mean, chances are every pediatrician that's been in practice for some period of time has seen a kid with this issue and just not known what's going on, right? Just written it off as something else, prescribed medication, told them to see a counselor, or said, well, that's just part of development. That's just the way your child's developing, and all kids are different, right? Those are the things that you hear, but you can't accept that. I mean, absolutely not.
If we would have had like a really good doctor at first, it would have been really nice, because then, could have gotten started a lot earlier. But with people who just like don't even know how to recognize the signs and don't know how to find a doctor, and they're so far away, it's like your kid will like have it for so long you can't even do anything about it. Antibiotics
might be enough to treat the child, to treat the infection that's causing the PANDAS flare. In some kids, that's enough. Keeping strep infections, addressing them early, keeping them away, or whatever other infection it might be. Our daughter, when she was 6 years old, it kind of went away on its own, and she had a full remission for 6 years before it came back. And if we had known more then, right, and we could stay on top of the infections, really knew what we were dealing with, I think it would have been a different outcome, and we probably wouldn't have had such a severe issue with it 6 years later that took really a couple of years to get on top of, right? We were very fortunate as far as, a couple of years sounds like a long time, but some people go 5, 7, 10 years, working with doctors, working with dozens of different doctors, trying to figure out what's going on with their child before they finally get some answers, if they do. And the more time that passes, that's more behaviors, that's more of your childhood that your child is missing out on, and they're probably developing some other coping strategies just to try to get by in life. And it's you know, we want our kids to develop and thrive and, you know, not deal with these issues. But yeah, antibiotics can be enough, right? There's other treatment options that, you know, IVIG is kind of for the more severe cases, and in our situation it was absolutely needed, but it's very expensive, and most insurance companies won't cover it, right? So there's definitely a battle in trying to get coverage for that. You know, for us, it's worth every penny. It's brought our daughter, you know, back to us. Kids really need this help, so I think understanding the condition as early as possible and really getting ahead of it is so important.
And that breaks my heart. All the families that don't have the resources or the access. I mean, you know, to get IVIG or the needed treatments, it usually is out of pocket for people and for families. And I mean, it's tens of thousands of dollars. And why do you have to choose how you're going to pay for your child's treatment to get them well? And then you think, gosh, you know, if it would have been recognized right away, would we even need to do this? Would this even be necessary?